All right, everyone. So sorry about that technical glitch. And we're just gonna give everybody a moment to connect. Hopefully everybody's still holding on. And it's a rainy day here in New York City, and that could be the reason why. I don't know. Anyhow, we're really excited to be welcoming everybody here today for today's talk. We have Bryan Groleau, who will be talking about keeping your skin moisturized and basic wound care. So important, I think. And before we actually welcome him onto the scene, I'd like to welcome my team so that you can meet them if this is your first time. And if you've been on, you kind of know who they are by now. First, we have Alyssa Fiorito. She is the NLN Garment Program Manager. We have also below Aaron Sokolsky, who is a marketing manager. And hopefully everybody's still holding on. Oh, there's that echo again. I always forget to do that. 1 second. It's a rainy day here in New York City, and that could be the reason why. I always forget to shut that off. Anyhow, Aaron Sokolsky is our marketing manager. And here we have Veronica Cineras, who is our social media manager. And who we also have, but I think will not be joining us via video is, we do have Christy Blair, our project manager. And two other members are Jennifer Williams, who is still working right now. She is our continuing education manager, and Nicole Ballard, who is our membership manager. Thank you, ladies, for everything that you do. All right. And they'll be working behind the scenes to help us out with the chat and the Q&A and making sure that everything's really smooth. All right, and so now it is my pleasure to welcome Bryan Groleau. Actually, let me just make sure he's here. Is he here? Yes, he is here. All right. It's sorry about that, Bryan. So it's my pleasure to welcome Bryan Groleau. I've known Bryan since 2016 when we had the NLN conference that year, and we've just been great friends since then. And I think an interesting thing for you all to know in terms of how he has saved me from that time when I met him in 2016 in his contacts is the best lymphedema therapist in New York. That's how I come up. Anyhow, it was just a joke, but it stayed. And anyhow, Bryan, we're so excited for your talk tonight. I'm actually interested to learn from you. I'm wound care certified as well, but with everything, we can always learn more.
Hey, well, thanks, Jeanette. Thanks for having me. I appreciate it. Thanks for having me be
all
here.
Yours.
Cool, thank you. Let me go ahead and share my screen. And all right. There we go. All right, so we're going to talk about wounds, and I'm going to go ahead and give you a warning now. There are a couple pictures in here you might not like the looks of, but sometimes that's just the way it goes, I guess. But hopefully I can share with you some of the reasons why we get wounds and the different types of wounds and what you can do for them. So let's go ahead and get started. There we go, right out of the gate. We've got some wounds that don't look so hot. And these might look familiar to you, they might not. But regardless, when you have a wound in the lower extremity, when you have a wound and you've also got lymphedema present, they're going to be pretty wet wounds. And there's a lot of drainage with these. It can be hard to manage, and it's hard to know what to do with these. It doesn't matter if you're a patient or a therapist. Not all lymphedema therapists are certified in wound care. And even if you are, it's still sometimes hard to know how to deal with wet drainage on your leg. That drainage can lead to infection and lots of problems. It can actually make the wound bigger. And you can see in this picture all the way to the right how wet the leg is, and it can deteriorate the skin. So we need to learn how to control that and learn what's normal in a wound and what's not normal. And that's what I want to talk about. So this is what we're going to go over. What's causing the wounds to begin with? What can we do for them? And what are some of the red flags? And I know that's important to you because you want to know what's going on with your body. I do. How many of us get right on Google as soon as we see something wrong? I know I'm notorious for this. and then we see all the wrong things and everything that it could be, and we're starting, to freak out a little bit. So I'm going to let you know what some red flags are and what things you don't need to worry about. And then, of course, we have to talk about compression, as we're talking about lymphedema and we're talking about vein disease as well. And both of those require compression in order to make things improve. So venous leg ulcers, or I should call them venous wounds, that's what you're seeing here. And this is actually the most common type of wound that you're going to see in relation to lymphedema. And sometimes with lymphedema, we get wounds, and they don't have to be venous leg ulcers. I just put this up here because this is most commonly seen in conjunction with lymphedema. And they're mostly on the inside of the ankle. And you can see this particular wound has some of that brownish looking skin around it. And that's actually normal. I mean, I don't want to say it's normal of vein disease. This is a characteristic of someone that has vein disease. A lot of people get nervous and uncomfortable when they see that. Is something wrong? Yeah, something's wrong, but it's going to be okay. This is a characteristic of vein disease. We need to focus on that wound, of course. And like you've already heard me say, these wounds can drain a whole lot, and they can be open for a really long time. Average time that it takes to heal a wound like this can be like 6 months, as you can see. But to be honest, I've seen these wounds open for years, and it can be really tricky. Now, some of that has to do with the fact that the severity of the disease can be, it can be severe, and that can make it hard to close. But sometimes it has to do with compression. And are we in the right compression? Do we wear enough compression? Do we wear it when we're supposed to wear it? So those things also have a part to play as well. Another, I know you've seen this picture already, but what you didn't see was the connection of the vein disease along with this wound. And this isn't what we, clinicians, therapists, we don't get to see this, and neither do you as the person that could have this problem. But this is the vein disease. This is the vein that's causing the problem to begin with. And this also tells me that we have a vein problem, not a wound problem. We have a vein problem, and we have to put compression all the way up on this leg. And oftentimes when you have a vein problem, you also have a lymphatic problem. And that's why you hear me talking about vein disease a little bit here. And I have a few more slides on veins, but I really bring it up because a lot of times they go hand in hand. The other couple things to know about some of your wounds with lymphedema or with veins or both is they don't really have a rhyme or reason to the shape of them. Look at this picture to the right here. It's kind of all over the place, and you can see that it's also very red, and it's got some white around the edges of the wound, and that's because it's just so wet. And when that wetness sits on the skin, it starts to deteriorate the skin, and we've got to get control over that so that we can help our wounds to heal. A little bit more on the veins. So I want to point this out to you. There's the veins. This kind of represents the venous system, and this redness that you see here, this is a muscle, because you've got different parts of your venous system. You've got superficial veins, and you've got some that are deeper. But what they all have, doesn't matter if it's in the superficial or the deep, are these really cool valves, and you can kind of see them here. And I want to point these out to you because this is how your veins work. This is how your blood gets back to your body. Because of these valves, they open and they let blood go through them, but when they close, they don't let anything come back. And every time you move your muscle in your leg, it's pumping the blood back to your body. And this is, like I said, how we get blood back, which is really, really cool. And here's a great picture of that. Every time you contract your muscle, here's what's happening. I got two different great pictures of it. You can see the valves open, but this one's closed. So all that blood can go up, and it can basically flow against gravity, thanks to these valves, thanks to moving your muscle. So if you've got something out of this already, it's that you've got to be moving your muscles. And again, it doesn't matter if it's lymphedema or vein disease. This applies to both. So So this is a big thing that I spend a lot of time teaching my patients. It's simple, but it's very effective. Get your leg elevated, get your leg moving, and it's going to help pump that blood. But let's look at what happens when you have vein disease. This picture right here represents normal veins, okay? And then you can see to the right here, this is a vein that's dilated or a diseased vein. And here's what it looks like in the leg once again, kind of similar to the view we've already seen. And then of course, it can really cause these wounds. So this is what's happening in vein disease. Not quite exactly what's happening with lymphedema. It's not the same, but the lymphedema has to really compensate for the problem. So it's working overtime as well. And it ultimately can lead to edema, lymphedema, and in combination with the wound. So that's really it on vein disease. I wanted to really let you know about that so you can help to understand if that's the case for you out here. Ultimately, what we need is right here. We've got to increase circulation. I have venous return here, but we've got to increase lymph return as well, lymphatic return. We can do that with compression. So if we can increase circulation and reduce edema, we're going to gain wound closure. We're going to gain control over our wounds. We're going to gain control over the drainage. And we're even going to gain control over all the bacteria that's going on with it. So compression is one of the big key factors, or what I call part of the recipe for wound healing. When you have wounds and the drainage, like I've already talked about, they can cause a lot of problems. But what causes the drainage itself? And sometimes we think it's just the wound. I have a wound and wounds drain, which is true. Wounds, they do drain a lot. But sometimes that drainage can be a lot and it can be excessive. And you wonder to yourself, is this normal? Should my leg really be draining this much? I mean, I know I have a wound. And, disclaimer here, I'm showing you pictures that are kind of the worst of the worst. They don't all have to look like this. They can be much mellower than this. But regardless, these are the questions we ask ourselves. Should my limb really be draining this much? And if that's you asking yourself that, well, we want to make sure we don't have an infection, because an infection can cause increased drainage. And then also there are other things that cause drainage outside of the wound itself. If some people have hypertension and they're on medication, some people take diuretics for this. And if you take diuretics and you miss diuretics, or you miss your medication, or you skip your medication, then you're messing with how much fluid is in or out of your body. And that can cause edema. So sometimes things like heart failure, or we call it congestive heart failure, or kidney disease can lead to things like edema. And those can cause drainage too. So your wound doesn't have to be infected to be draining a lot. There are other things that cause edema outside of lymphedema and outside of vein disease that can cause the drainage to happen. It's good to chat about this with your doctor, with your therapist, or someone that can understand and help you piece the puzzle together. Why is my leg draining so much? I'm worried that it's infected, or it's not infected. Do I have some other things going on in my body that might be contributing to this drainage? And here are some of the complications that happen from it. We've talked about the maceration of the skin, or what I call the deterioration of the skin. If you've got that much drainage pouring out of the wound, you're going to lose some nutrients as well, and it's going to slow the wound healing down. It's also going to get into your compression, and then you've got, that's always annoying, because now you've got soiled compression or bandages or whatever it is you've got in your leg, and that can collect bacteria. We don't want that happening. So all of this to say is how do we manage this? No matter what level you're on, again, you're seeing the worst of the worst pictures here, but no matter what level of drainage we're talking about, how can we manage that properly? So let's talk about drainage for a quick second.
Hello, everyone.
Jeanette, we still good?
I guess the technical glitch is not. Let's just see here. We're just there. So
Just let me know if I'm good to go.
Bryan, I would say you're good to go. We can still see you and hear you. So,
all right. Thank you.
yep.
All right. So we're going to talk about exudate. I want you to know what's normal, what's not normal from that wound. Clear drainage is normal. I got the clear drainage here, and I also got the scientific name for it. Let's not worry about that. Let's talk about clear drainage. That is normal to see. So don't expect to have a wound without drainage. You're always going to have drainage. It's healthy to see drainage. What you don't want to see though is bloody drainage. Unless you go to a wound center and you recently had debridement, that would be normal, because if you've had debridement, well, that can kind of cause blood to occur. So that would be normal. But if that's not the case, we don't want to see bloody drainage. That could indicate that there might be trauma to the wound. Maybe if you took a wound dressing off and it was stuck and it caused bleeding. We don't want that to happen to the wound. We want to protect the wound and keep it keep it from trauma. We don't want to rip off any good possible skin growth that happened. And same with pink. Pink is just a combination of the clear and the bloody drainage. And this is kind of normal. Again, if you've just had debridement done, or if your dressing is stuck to your wound, that can cause that. And if that's happening, we got to change it up a little bit to make sure that stops. But what I really want you to know about is this discolored drainage here. If you see this, it can be thick, it can be discolored, green, brown, tan, gray, and it can also be very odorous. If this is something that you find on your wound, this can indicate an infection, and this is not what you want to see. And this is something you want to see the doctor about right away. And an interesting story is I had a patient with this very thing, and the patient didn't know at all what was going on until I, finally did see the wound, and I recognized right away, oh, we've got an infection. We've got to get you to the doctor. And it was a little bit too late at that point. I mean, it wasn't too late. We were able to heal the wound, but we did lose a lot of ground that we could have gained if we had caught this sooner. So if you see this, don't wait on it. Get to your doctor as soon as possible, because you want to make sure you are fighting that infection. Clear is good. Thick and colorful, not so good. Here is what we call lymphorrhea. This is a fancy word for what I call weeping. And it's kind of when you've got drainage from a leg, but there's no actual wound open. This happens all the time, especially that picture to the right. That happens all the time. You've got kind of drainage coming down your leg. You can call it drainage. You can call it weeping. You can call it fluid. You can call it exudate. You can call it lymphorrhea. It really means all the same thing. Lymphorrhea is really, though, like if this picture to the left, it kind of has that white look to it, and a lot of people call that lymphorrhea because it's kind of lymph fluid leaking from the skin. So let's talk about some wound dressings that are going to help you get this stuff under control. The first thing that we need to know about healing a wound is that we have to have an environment that's moist. In other words, like your tongue. I have this picture of the tongue. I have this picture of a dog's nose, because if you feel your tongue, it's wet, but it's not sopping wet. If you feel a dog's nose, you'll have some residue on your hand, but it's not sopping wet. And that's how a wound heals, because that's what's normal to the wound. That's how new skin can grow, is when you have this environment that's moist. A lot of people like to think we're supposed to keep our wounds open to the air. I've had a lot of patients that used to tell me that I'm doing this wound care on their leg, and they'd say, well, can't I just leave it open to the air? And I would say, no, absolutely not. You can't leave it open to the air, because if you leave it open to the air, then all the cells and all the growth on that wound are going to die on the wound. And if they die, they're going to attract bacteria, and that can lead to infection. So we want to keep our wounds covered at all times. It's going to protect them from the outer environment, protect them from bacteria. It's also going to keep them moist, where things can grow, new new layers of skin and so on. So moist wound healing is what is preferred. And you're gonna, oftentimes we wanna use wound dressings that really preserve that moisture. We don't want it to dry out. We also don't want it to be too wet. So sometimes we use dressings that soak up a lot of drainage. That can also help balance the wound out. So ideally, this is what you want out of your wound care dressing. You want it to manage the amount of exudate or manage the amount of drainage that you've got. You want it to manage bacteria, and you want to make sure it doesn't hurt when you take it off. There should be no trauma to the wound when you take off that dressing. I got this funny cartoon to the right because there's 10 different ways to do wound healing for people, and 10 different protocols we could do. And some of them are just really, you can get as scientific as you want with them and really detailed, but really what it comes down to are these 3 things. It's really not hard. Manage the exudate, manage the bacteria. And I'm going to explain that a little better. These are typical products that people use to manage exudate. We have ABD pads and we have gauze. Pretty normal. You can find this stuff at CVS and Walgreens, any grocery store really. But these aren't really made for the types of wounds that we're talking about. If you've got lymphedema or vein disease or both, and you've got a wound, I recommend that you do not use these. And the reason is because when they get wet, they hold on to moisture, but they hold it close to the skin. And it can cause the skin around the wound to deteriorate even more. It's okay to use them to clean a wound, but don't use them to absorb drainage because they can actually make the problem worse. Also, bacteria can get through this material here. So if you're covering your wound with gauze and you're holding it in place, bacteria can get through that and it's not going to protect bacteria. So these break the rules that I just went over. It's not going to manage the exudate right, and it's not going to manage the bacteria correctly. So we've got to go away from these. These were made for surgical dressings, and they've made their way into advanced wound care because it used to be all we had, but that's not all we have anymore. We've got much better products in place. Starting with this is called a foam dressing, and the foam is absorptive. It's really comfortable to wear. It breathes well and protects the wound very nicely. But these also absorb drainage in a way that wicks it away from the wound. And these can be really, really helpful if you've got a little bit of drainage, maybe a little bit more than a little bit, maybe like I call it minimal drainage, maybe a moderate drainage. I would say maybe quarter sized, $50 sized at the most would be what I would use this for, and it will do a good job. But any more than that, this won't work. It doesn't hold enough drainage. So if you've got that much drainage, like the pictures I've been showing you, you're going to want to go to an absorbent, what we call a super absorbent polymer. It's a fancy word for something that absorbs a ton of drainage. And you can see here in these pictures that I've got, these little beads, when they took on water, they grew to like enormous amounts. They can hold 300 times their own weight. And so what people have done is they've learned, hey, we can crush these up, put them in a dressing, put this against your wound, and it absorbs like you wouldn't believe. It's unbelievable. They absorb, they take the moisture, they take the fluid away from the wound, stores it in the dressing, leaves the skin around the wound really nice and dry, and it's very ideal. So this is what I recommend for drainage. And here's some of the benefits and features of this type of dressing. We call them SAPs. If you call them an absorbent dressing or a polymer dressing, you'd probably be able to find what you're looking for, but SAP is really what we call it. This one has a backing on it, which I like because I don't like it when the drainage comes through the dressing and onto your compression. You don't want to see drainage on your compression. And so when you've got a backing, it locks it into the dressing. That's ideal. You do have to be careful though, because sometimes these dressings, when they take on a lot of fluid, you can see how this one puffed up a lot, and they can cause pressure underneath compression. So you want to make sure you've got something that's going to be able to absorb all the fluid. and that it's going to bring it into the dressing and bring it, kind of spread it through the entire dressing. Whoops, kind of like this right here. You can kind of see that the drainage was kind of spread out through the entire dressing. It keeps the pressure low under compression. So that's what I would do for absorption for wounds. Something else I want to go over with you is cellulitis versus dermatitis. One thing that people really worry about is cellulitis. Do I have an infection? Am I going to get an infection? And quite honestly, everything that we see that's red on the legs, we automatically assume that it's cellulitis. Oh my gosh, I've got an infection. But that's just not the case. Because when you've got vein disease or a wound in the leg, there's lots of reasons to have redness. And I don't want you getting all nervous because you see redness in your leg. So here's what cellulitis looks like. You see how it's in one leg here, and you've got it's a really bright red appearance. This definitely is a very classic looking cellulitis. Also, you don't have to have symptoms, but most likely you're going to. You're going to feel pain. You're going to feel warmth or heat, maybe even a burning sensation. You might feel nausea. You might have a fever. When you've got an infection like this, there's going to be signs and symptoms that there's generally going to be signs and symptoms that help you identify that. So know the symptoms of cellulitis. That will help you a lot to know what's going on with your body. Again, redness, burning sensation, fever, heat, and it's hot to the touch. It doesn't go away. And I'm going to show you something else here in a minute. This is dermatitis. It looks bad, right? I mean, it's not good, but it's also not an infection. So in other words, it doesn't look good, but it's really not bad. This is a characteristic of what happens with someone with vein disease. And sometimes, because those valves, remember the valves I showed you in the diseased veins, and that backflow that you get from vein disease, it can leak into the tissue and cause this discoloration. And when that happens, this is what you get. If you feel these legs, they're cool to the touch, they don't hurt, patient's not bothered by this, it just looks bad. And it starts to get darker and more brown, and that's just what vein disease does. So you have to be aware of symptoms of cellulitis, because that is not what this is. And so because I've seen it enough times now, I can figure that out. But it's good for you to understand this as well, so you can kind of discern what's going on with your body. The other thing is contact dermatitis. This is when the skin on the outside skin gets very irritated or inflamed. And it's a lot of times from drainage or too much moisture, the skin gets irritated and inflamed, and it can turn bright red. So just to show you, this is the layers of the skin. Dermatitis generally happens on the outer layer of the skin. And stasis dermatitis can happen on the other layers of the skin too. But what I want you to know is that cellulitis is an infection of the skin and the underlayers of the skin. Whereas the dermatitises are really just in the skin. They don't go to the sublayers. So one's an infection, that's cellulitis. The other is just inflammation. This is what I was going to show you. See this line? We call it a line of demarcation. If you think you've got cellulitis, you can draw a nice little mark around where the borders are of your redness. If that redness grows beyond that, and you're not in compression, or even if you are in compression and it starts to grow beyond where your compression ends, then you probably have a problem. That's probably cellulitis. You can see kind of here in this leg, see how it shows up in both legs? Well, cellulitis doesn't just hop to the other leg so perfectly like this. It doesn't work like that. It would have to go through the whole body to get to the other leg, which would mean it would be systemic. That's not how cellulitis works. It's not just going to jump to the other leg and do what you see here. And that's how I know it's not cellulitis. Also, I can tell this probably had too much moisture under the bandages. Sometimes we put too much, sometimes you can put too much lotion on the legs, believe it or not. And when you put bandages over too much lotion, it can cause irritation depending on what the lotion is. So there you go. Let's talk about wound hygiene. I recommend using soap and water. You can use antimicrobial soap if you want to, but don't use it all the time. I tell people, don't just use antimicrobial soap throughout your house. Only use antimicrobial soap if you think you've got an infection or an open wound or an open cut. So that's what we do in my house. We have antibacterial soap and we save it only for when there's a cut. That way we don't develop any resistances to the antibacterial properties of that soap. Use regular hand soap unless it's a cut. Wound cleansers you can get at Walgreens, CVS, saline water, stuff like that. And this is when you can use your gauze to clean those wounds. I don't think you should be using alcohol or hydrogen peroxide unless the physician tells you to. Those are really geared toward infections. And unless your wound is infected, I would not use those. And if it is infected, then you should get to the doctor so they can use something different than alcohol or peroxide. So here's the big picture for lotions and ointments and Vaseline. We want to moisturize the skin, and the closer you get to lotion is going to be better for your skin in hydrating it. So right, water being hydration. So lotion, that's why I've got lotion and water so close together, because that equals hydration. Vaseline, see how it's so far away from water? Because it's not hydrating. What it's doing is it's protecting the skin. We tend to confuse ointments and creams and lotions. And I like to use ointments as a barrier. If any of you have ever changed a diaper in your life, you know that you put ointment, all over your baby because you want to protect it from urine or whatever bodily fluids that are going to get onto the skin. But ointment is a barrier cream and it protects it. And that's what we do for wounds as well. Put that ointment around the wound to protect the wound from the drainage. But we don't use ointment as a moisturizer. And that's what can sometimes cause the dermatitis we just saw. Always try and move toward the lotion. The more you move toward lotion, the more you're moving toward hydration. All right, we're rounding the plates here. We're going to talk about Manuka honey, what I think is the simplest wound care protocol ever. Literally, my motto is, when in doubt, put honey on it, because you can put honey on any wound at any time and it will be fine. The function of honey is you can do anything you want with it, basically. And what's really cool is it's completely natural. We're talking about made by bees in New Zealand, and it's very specific to that region. That's why it's called Manuka honey. It's basically from the tea tree, bees that harvest honey from the tea tree. And they've made this great organic product for us that has a lot of antimicrobial properties in it. It has no resistances to bacteria. So you can use it on any type of wound. So I call it the Swiss Army knife of wound care, because like you heard me say, you can use it on any wound at any time. It can debride wounds, meaning that it can help your body digest some of that dead tissue out of the wound. It's an antimicrobial, so it can prevent infection. In fact, bacteria cannot grow where there's Manuka honey. It just doesn't allow that environment to happen, which is super cool. It controls odor. It's also going to stimulate your wound healing. So it's got all these things in one product. Typically in wound care, every time I want a function done, I've got to change a product, but not with honey. You can just put it on anytime, at any point, and it's going to help you. So this is what's so cool, and this is why I love passing this information on to you, because if you've got a wound, you don't know what to do with it, you can put honey on it. And that's really just so simple and easy, and really, you don't have to think about it. You can just do it. So I'm going to show you a couple products that Medi carries, and I am an employee of Medi. I'm an educator for Medi, so in case you didn't know that, I wanted you to know. This is Activon Tube. This is a product that Medi carries. That's 100% Manuka honey. This is called the Eclipse. This is one of the absorbent, the SAPs that we also have, that absorbs a lot of drainage, a lot of different sizes and shapes. And it can, like I said, it can absorb a whole lot of fluid. In fact, I have a video coming up where I show you just how these work. So stay tuned for that after this talk. This is a foam, and this is how you can put a foam on. Put it right on top of the wound. You can wrap a gauze around it, or you can put stockinette on your leg and stuff it down in there. Make sure it's over the wound, make sure it's nice and smooth, and you're good to go. This is the Advisorb. This is the foam dressing that I was just talking about. Conforms really nicely to the leg. So here's really the recipe that I say, the simplest wound care recipe or protocol out there. Activon, Manuka 100%, it's gotta be 100% Manuka honey, and combine it with one of these absorptive. If you've got a lot of drainage, use Eclipse. If you've got a little drainage, use Advisorb, and you're good to go. And I kind of tied it to some pictures for you. If you've got this kind of a wound, you're gonna need this kind of, you're gonna need this product to absorb all that drainage. The only time I would not use honey is on a wound that is infected. And the reason is you can put it on there. It's not going to do any harm. In fact, it will do good, but it just does not work fast enough. If you have an infection, always get right to the doctor, because you're going to have to do antibiotics and antiseptics to kill that infection right away. Honey will not work fast enough for you. But if you put it on there, it's not going to do any harm. You still can do that. Here's another example of something that doesn't drain as much. This is Advisorb. This is the foam I was just showing you. Combine it with the Manuka honey. You're in good shape. Once again, the recipe for wound healing: control the bacteria. How do you do that? 100% Manuka honey. Control the exudate. How do I do that? Foam or SAP. Compress. How do I do that? Multi-layer bandages, compression socks. I have a picture of the Circade product here, which is adjustable Velcro compression. That works also. And if you're looking for a place to get these products, I put two up here for you. These are the two places that I know of that are carrying the products, the honey, the foams, even the compression. So there you go. That is, I hope that you learned something from this. I hope there's some good tidbits in here. And that's it. I can take questions. I know there's another video coming, but there you go.
Hi, Bryan. It's Alyssa. Thank you for this presentation. This is amazing and so informative and really helpful.
Good.
We do have a few questions though.
Great.
So Jane is asking, do you recommend Manuka honey to help eczema flare up on a lymphedema arm, not just for wound?
I could not tell you of any studies that have been done on that, but I can tell you that I've heard people doing that very thing, and then they call and say, yes, that really helped. It's not going to hurt. I would definitely give it a shot. I've heard some good stories of it helping. At the same time, my daughter has eczema, and we've used colloidal oatmeal. Take it for what it's worth. I don't think you're going to do any harm with the Manuka honey, but at the same time, it's not a lotion, so it's going to be sticky. And if you're going to put it on there, you're going to want to cover it. You really are never going to put honey on an area of the body and not cover it. You're always going to cover it. It's pretty sticky. I mean, it's honey.
Yes. Okay. Oscar is asking if one can use regular honey.
Nope, because it doesn't have the same properties as Manuka honey. The difference between Manuka honey and regular table honey in the antimicrobial properties, go ahead and Google it. It's unbelievable, the difference. Not to say that table honey couldn't work, but the sugar content, I don't know about all that. I know that Manuka honey has the right levels of pH balance, antimicrobial properties, and I don't think table honey is going to be effective. Although I think it's healthy to consume, I don't think it's going to have an effect on your wound.
Okay. Lynn is now asking if these products are covered by Medicare, Medicaid, and commercial insurances.
Well, those are all different state to state for one thing. And the way this works is, first of all, honey's not covered by any insurances. So that's always an out-of-pocket expense. And these products can be purchased out of pocket, but some of them are covered as well, but they're only covered when you're seeing a physician who's actively doing debridement and documenting specifically about your wound. And they get into specifics like, is it a full thickness wound? Is it a partial thickness wound? And there are certain eligibilities and qualifications that will cover a dressing or not. So if you want coverage, go to your doctor, and if they can get you dressings, they certainly will. But there's definitely a criteria, and you have to be going to a wound or having to be seeing a physician that can do debridement.
Okay. And can you tell us what is the size of the Advisorb bandage? Did you say no bigger than $50?
No, what I was saying was the drainage. If the drainage amount is probably, I would say, like quarter size or $50 size. If there's more drainage than that amount, I would say switch to the SAP. But the foam itself comes in multiple sizes.
Okay.
So yeah.
Thank you. All right, here we have some more. What would the daily cleaning protocol be to prevent recurring cellulitis? Just soap, water, and lotion? Any specific brands?
Soap, water, and lotion. Well, if you truly have recurring cellulitis, that would definitely be a good question for your doctor, because they can, there's different types of cleansers out there. Some people, have to wash in HIBA cleanse. People recommend antibacterial soaps. I'm a little hesitant to answer that. Always keep it clean. So yes, if you only have regular soap in the house, by all means use it. Keeping an area clean is what's most important. But having a daily protocol for recurring cellulitis, yeah, like I said, I'm hesitant to answer that because of the fact that you might need something that's stronger soap, something more antimicrobial. So yeah.
Okay.
I don't know. If you can answer that question better than me, feel free to.
I was probably going to say the same thing, that if it's a recurring infection issue, that that's a discussion to have with the physician to see if there's something specific that they recommend.
I had a patient that had recurring cellulitis, and it was like every single year. And of course, she had medication that she kept on hand, and she knew her symptoms to a T. She could get that medication in and stop it from occurring. And that's usually where the treatment ends up heading to. Your daily routine of hygiene is important. But sometimes it still doesn't matter what you do, that cellulitis finds its way. So meet with your physician on that. That's what I would say is best.
Okay, I agree. Thank you. So do you have an idea how long we can leave the honey on the skin?
You can leave it on for 7 days. Whether it will stay in place for 7 days is another issue. And the dressings that I showed you are also can stay in place for 7 days. But what it comes down to is you have to change your dressing when your wound really needs it. And so a lot of time people end up changing it every other day, every few days, sometimes every day. It just depends on how much drainage there is. And remember, if there's drainage and that drainage is going into a dressing and you've got honey on it, well, that honey could also find its way into the dressing. So you might want to change it more often if that's the case. If you can keep that dressing in place, then you're going to keep that honey in place too. So it just depends on what's going on. I really base how often I change a dressing based on how much drainage there is. And if you've got a dry wound, then sure, you can leave that honey in place for 7 days if you want to. I would probably be more apt to do it for 3 days myself. But it's no harm to keep it.
Okay. Let's see. Next question is, do you have a recommendation as a general moisturizing lotion to use on an arm prior to putting on a compression sleeve and glove?
I do. I have a few of them. If you're asking me for name brands, the ones that I go to, first of all, I always had great luck with Curel. I felt like it absorbed into the skin. I know a lot of people liked Eucerin. That was not one of my favorites, but I've seen it work. I like something that has a little less, I guess, grease in it and can penetrate the skin. I used Lubriderm, Curel. I used Johnson & Johnson had a intensive care that seemed to work. And but I always had the best luck with Curel for some reason.
It's interesting. I'm glad. I'm going to actually take a look at that myself. I've been
Yeah.
using Eucerin in my practice too, pretty exclusively. But some people just don't like it.
Well, you
So,
know, we learned Eucerin. That's what we learned in
right.
lymphedema school, and I branched out. Can I say?
Hey, it's always good to have other recommendations. So we appreciate that. Okay, so let's see. Joan is saying, while in Mexico, my husband fell and scraped his knee. The owner of a restaurant saw his fall, came to our aid with a mixture of honey and bacon or pork fat. She says, I
Whoa.
never saw an open wound heal so fast.
I can't say anything about the pork fat, and I can say something about the honey. It's an antimicrobial. It probably wasn't Manuka honey, but I have really not much to say except maybe your husband heals really fast, and the pork fat probably helped keep it moist. So there could be some of that action going on, but
Right.
that's pretty
Very
cool.
interesting.
I'm glad that worked out.
It looks like we have, I think, one more question. Alice is saying she has a Haglund's deformity causing heel irritation and calluses. Will honey make a wound go away there? Her shoes irritate as well as stockings, so she uses regular Band-Aids under her compression, but she's allergic to Band-Aid glue. So she's asking if a foam bandage is free from glue sticking to the wound itself or just around the edges like a Band-Aid.
The foam bandages don't have adhesive on them. Some of the foams are made without a border, and so there absolutely is nothing that sticks at all. You'd have to wrap it with a gauze or something like that. There are bordered foams that do have a stick to them, but it's not adhesive. It's silicone and it's very gentle on the skin. It's generally pretty hypoallergenic and very comfortable. So those are also something that could be a choice. As far as the honey goes, if it's an open wound, the honey is going to help. But in wound care, if you ever went to a wound care clinic, what they do for those types of wounds is they cut the callus off to soften it, and they might even give you a callus softening type of ointment or cream or something, because those calluses, what happens is the callus is actually what's keeping the wound from closing. The wound edges can't come together because the callus is there and it's too firm. So it might be worth your time to see a podiatrist about those calluses to offload that pressure. You may have already done this, but sometimes it's a matter of finding the right shoe, the right foot support, the right podiatrist that can take care of all those things. If the wound's open, honey is going to help. Is it going to solve your problem? That sounds like it might need a specialist to help you with that.
Okay. Can you repeat somebody's asking for you to repeat the moisturizing lotion that you mentioned.
Curel is my favorite.
Curel. Okay.
There was a Vino. I used to love a Vino. The oatmeal one was really good. Lubriderm, of course. Lubriderm was fragrance free. It's always important. I don't use fragrance. That was one of the things we learned in lymphedema school is no fragrance. Johnson & Johnson had an intensive care that was really good. And those are really, I think that's 4. I don't know that I can remember anymore.
Okay, thank you. Angela is also asking, is it safe to use apple cider vinegar to clean the wound? It would burn, but will kill the germs.
There are people I know that use vinegar. I don't know whether it's apple cider or not, but vinegar is a good cleaner. It also is something that I really reserve only, once again, for infected wounds, though. Vinegar is only going to fight certain types of bacteria, and you never know what kind of bacteria could be on your wound. So really, you shouldn't use vinegar unless you have an infection or a lot of bacteria on your wound. You should really reserve that just for infection. I recommend going back to soap and water and going to saline. Normal saline is something you can pick up pretty cheap at your local pharmacy. That's kind of what I recommend for your daily cleanser. Soap and water or saline, as long as there's no infection, those should do.
Okay. Marion is asking if you can put these same things to diabetic ulcers, to heal diabetic ulcers.
Absolutely. Once again, if you have a diabetic ulcer, you you should see a wound specialist to help with that, because you're talking about calluses still. But one of my protocols for a diabetic ulcer is honey, cover it with foam. Absolutely. I did that so many times.
Okay. Oh, and somebody's saying there's different types of Curel lotions. There's so many different variations. Is there a
Yes.
specific one you like?
Fragrance free. That's about all I can remember from I think it doesn't matter. The original Curel is the one I used. I've tried different ones. They all work great. So as long as it's fragrance free is what I would say.
Okay, great. It looks like that is all the questions we have for now. So Jeanette is actually going to come back on and talk about our giveaway today.
Great.
Indeed. Thank you so much, Alyssa, and thank you so much, Bryan. I caught a good majority of that when the internet was working, but I look forward to the review and the recording, which will be uploaded by the end of today. And all the recordings, for those of you who are asking, are uploaded, so go ahead and check them out. And but before we play the Medi video and continue on with the sponsored portion of the webinar, we would like for everybody to please raise your hands so that we can then enter your names into the wheel of names. For those of you who are interested in the Medi giveaway, which is the Circade. So please just go ahead and raise your hands, and we'll make sure to get everybody's names onto the wheel. Marianne, I think that you are on the webinar for today. We're sorry about missing your name yesterday, but we will make sure that we get to everybody today. And so with that, I'd like to go ahead and share the Medi video. And one more thing, allow me to insert the disclaimers here now. The disclaimer is such that even though we absolutely love Bryan and respect everything that he shared with us today, you know, everything that he did share is the opinion of Bryan's, and it does not necessarily reflect the position of the National Lymphedema Network. We are working on updating our risk reduction practices, which, you know, includes skincare and how to take care of like some basic wounds. And hopefully we'll have that in time for our conference, which will be in the first bit of October 1st through the 4th. It's called A Mysterious Experience of Lymphology. And also all the products that we are mentioning today are also not necessarily endorsed by the National Lymphedema Network. We are simply presenting them to you because it's, you know, something that is available to you, the community, and it's important for you to know what your options are. But we do not necessarily endorse any of the products. Similarly, even though Medi is a wonderful supporter of the National Lymphedema Network as a Magenta sponsor, thank you so much, Medi USA, we are also not necessarily endorsing any of their products as well. Same reason, we are simply connecting them to you and you to them because they specialize in products that are relevant to you, the patient lymphedema community. With that, it is now my pleasure to now play the video that Medi had prepared for us, which also has Bryan in it. And so if you can give me one moment just to do that. And here we go.
All right, welcome everyone. My name is Christopher Miles and this is Bryan Groleau. We are from Medi USA. We are both from the clinical education team and we're super excited to do this brief session today. And we're tackling a big session today. We're going to be talking about when folks have more extreme lymphedema in their lower leg and the skin actually tends to weep or leak fluid out. Is that possible, Bryan?
Happens all the time. Yeah, absolutely.
It happens all the time. And is it a good thing just to get the fluid out?
You know, that's a good thought, but it's really not a good thing. You don't want any drainage out of your leg. It can really attract a lot of bacteria. It can lead to infection. So no, not a good thing.
So not good. So with lymphedema, we know we have too much fluid, but we don't want it to leak out. We want it to decongest and go through the body. So what are different causes of leaky legs?
There's a couple of things. Sometimes when your leg swells up so much that the skin just stretches too much and it can open up. I mean, something as simple as that, you've got lymphedema, a lot of it, you bang your leg against the surface and it opens up. But for other reasons like vein disease, a lot of people have edema in conjunction with vein disease, and vein disease leads to open wounds. So there's a few different reasons of why skin might open up. Generally, if the skin opens up and there's leakage, it's because there's a lot of edema, no matter what the issue is.
Okay. So you use the word wound. So are these actually, when there's fluid leaking out, would you consider it a wound?
Absolutely, yeah.
So it's a wound. So can't you just put a Band-Aid on it?
Well, you know, you could, but unfortunately a Band-Aid is just not going to cut it on this, because what's happening is you've got a condition behind the wound. It's not like when you were a kid, you fell off your bike,
Okay.
you fell on the road and scraped your skin open. That's different. Now you've got, like I said, a condition or maybe even disease behind the wound that's causing a problem. And so we need way more than a Band-Aid. We've got to protect against bacteria.
Okay.
We've got to close that wound up.
So how do we do that?
Well, first of all, there's really two ways of doing it. Two things we've got to have. First and foremost is compression. If we don't have compression to combat the edema, to move the fluid out of the limb, then we're going to continue to have all that edema sitting in the leg. And where's it going to want to go? It's going to want to go out. It's going to find the area of least resistance.
So is this compression
Yeah,
that
this
we're
is
looking
great
at here?
compression. Yeah,
So what is this?
this is the Cercade Juxtalite. This is an adjustable compression wrap. And what's
Okay.
really good about the Cercade is it's adjustable compression. It's got Velcro. So we can just really easily put this on because it's straps. We can adjust the compression to it, and we can set the compression level to it.
Okay.
We know how much compression we're putting on the limb with this particular product.
So this would go up to the knee,
Absolutely.
up to the knee, and it
And it's
has
got compression on the foot too.
so foot and then the wrap.
Mhm.
Okay. So
Yeah, there's actually compression within this sock. It doesn't look like there's compression. It just looks like an undersock, but there's actually compression.
So if somebody wears this compression sock and the Cercade wrap, will that stop the leaky legs?
It will definitely help it. It doesn't necessarily stop it. Sometimes it does. It depends on what's going on. It's certainly a huge help, but usually you've got to have a wound care dressing to go with it that's going to help absorb some of that drainage.
Okay.
The word that we like to use is exudate, but it doesn't matter. It's all the same.
So drainage. So we need to put something bigger than a Band-Aid underneath
And more absorptive.
and more absorbative. So I see we've got a couple things here. We've got some gauze. I'm sure everyone's familiar with gauze. So is gauze, it's bigger than a Band-Aid. Is that
Bigger than a
going to work?
Band-Aid, but generally, you know, with lymphedema and with these types of wounds, this is going to fill up really quickly. And you know what else is? It's going to stay wet. When this gets wet, sure, it'll absorb the fluid, but it's going to stay saturated. So what happens, it gets wet and it sits on the outside of the skin, and it's going to break that skin down too. So it actually could make things worse in a way. So this is not really what I would recommend.
Oh, okay. Well, what would you recommend?
Well, what I would recommend is right here. This is a super absorbent dressing. And what it does, if you know anything about athletic clothing and like wicking material, like a lot of these athletes, they wear these shirts that wick away fluid and moisture off of the body. And that's what these dressings do. Like this is a super absorbent dressing, and it actually can wick away into the dressing, and it brings it within the dressing.
So this is the Under Armour of wound care dressing.
To me, that's exactly what I would call it.
Okay.
Yeah, for sure.
Very good.
And you want it to be able to hold that within the dressing. Like these don't. And this is another thing that a lot of people go to. This is an ABD pad. And it does the same thing, except that it can hold more. It can certainly hold a good amount of fluid, but the way in which it absorbs and holds fluid is not ideal. It just keeps everything wet around it.
So how does this one not stay wet?
Well, basically what it's got in it, it's got these, not to get too scientific on it, it's got polymers in it, and it draws fluid right into it. And so what it does is it pulls it into the back of the dressing away from the wound. It's got a very specific, I guess, science behind it that allows it to pull it away from the wound and away from the skin.
So effective compression to slow the leakiness,
Mm-hmm.
and then a more advanced dressing, such as this one. And what is this dressing?
This is called the Eclipse.
Okay.
Mm-hmm.
Okay.
It's a by a company called Advances, and we at Medi are a distributor of this product.
Okay, and you would put that underneath
I would definitely.
On the skin?
Directly goes against the wound.
Okay.
And then you can put your compression right over it. You can put a stockinette over it, and you can put whatever compression you're using right over it. Specifically, this Juxtalite could go right over it. And what it has, another really cool feature about this, is it's got this backing on it, which doesn't let things strike through or doesn't let the fluid come through. So when you put this on a wound, the fluid's going to stay within the dressing, but it's not going to come through this backward liner here, as opposed to these, which don't have that. Fluid's going to come right through it. It's going to get onto the compression, which is not ideal at all.
So you could actually see with a bad wound, you would actually see the drainage coming through this product. And I'm not assuming that it maybe smells too good either.
It's not good. It's a lot of bacteria.
Okay.
There's a lot of things. We've got to contain exudate and drainage in the dressing.
So with that Eclipse dressing, it won't come through.
Correct.
It'll actually seal it. All right.
Keep it right in the dressing.
So with that, I think Bryan probably should have to prove that and compare what the dressings may not do. So why don't we actually start a little science lab here, and let's see how these dressings wick some fluid.
Let's do it.
All right, so we're going to put these dressings to the test. So what Bryan just talked about is we have the Eclipse product here, which he's calling a more advanced dressing, and we're going to find out if it's actually more advanced than the other two common options that are probably seen out there. So I will let Bryan go ahead and commence the experiment that we're going to do.
Okay, sounds good. So we've got 3 cups, 3 plates, same amount of fluid in each cup. And so what I'm just going to do is put this dressing here and pour this drainage or this fluid right over this, and let's just see what happens, how it absorbs and takes on the water. As you can see, it definitely is absorbing, but it's going to hit max pretty quickly. And as you can see, we're definitely at capacity, and then some. You can see it dripping. I could even take this and wring it. So it can hold fluid to a certain extent, but once it hits capacity, it just saturates. And if you can imagine this being a wound, it's just gonna, if the size of your wound is a quarter, well, now you've got all the surrounding fluid and moisture around the wound itself. So that could really be a bad situation. So let's see what happens with the next one. This is an ABD pad. And I imagine this could hold all the fluid in this cup, but let's see how it takes on fluid. Let's just see what happens.
Oh, it looks like it's soaking it up.
Looks like it's soaking it up from the other side. All right, so we definitely have, like I said, it's probably going to soak it all up. You can see it's kind of dripping out a little bit. Now, when I touch this with my fingers, you might be able to see that my fingers also get wet when I touch it. Now watch this. I can also wring it out. So yeah, it holds moisture, it holds water, but it doesn't bring it in within the dressing. And anytime you can wring a product out or touch it like that and get your fingers wet, it's not pulling it away from the skin. So this could also be a problem. I guess if I had to choose between the two, I would choose this one. But still, in the world of wound care, this isn't really going to cut it, and it's just staying very wet. So let's see what we got.
All right, now we're going to see if this can handle it. So this one looks this looks small.
It is. It's actually smaller than the other ones, quite a bit smaller.
Okay.
So let's see how we do. Rapidly just kind of absorbs it right on up. Still a lot of fluid it's taking.
It's looking like we're
And
getting
we
to
still got,
full.
and we still got more. It's getting full. We're gonna push it to capacity,
It looks full.
but you'll see. I mean, this is a lot of fluid. Look at that. Now, let's look at our gauze. Same amount of fluid. And let's look at our ABD pad. Same amount of fluid. Of course, this did soak it up, but we could still bring it back out. Let's go and look back here at our eclipse.
All right, so I'm not seeing any fluid. So it soaked it all up.
Soaked it all up.
But I'm
Go ahead and touch that, Christopher.
Oh,
Show us your fingers. Are they wet?
no, not at all. It's gotten thicker. Has it gotten thicker?
A little bit. But it took on, gosh, I don't know how many hours.
I'm going to ask you to wring that out, though.
I'm not even, and I am trying. You try. So you can
So
see
it's all in
wicks
there.
it. It
It's
really,
like it's like filled up.
yeah, whipped it right into the dressing.
It's dry. It's dry.
That's the name of the game. And that's going to collect all of your bacteria, all your exudate. It's going to protect your wound and really keep things at bay. And keep that, remember, you've got the wound, you've got to keep the surrounding area to the wound healthy too. So this is an advanced dressing, and definitely you could see where this would be used under compression, no strike through, so, and holds quite a bit of fluid. So again,
So not wet on either side. So it'll keep your wraps dry. It'll keep your limb dry, and it's important not to have too much sitting fluid on your skin. Like if you stay in the bathtub too long or you're in the pool too long, you know how it gets all wrinkly and what we call macerated. That will slow down wound healing. So I didn't know if it was going to hold all that fluid, but I think you pushed it to the limit. And as we said, this is actually a smaller dressing than the others. Yet it not only absorbed it, but it is it's somehow dry. So technology, I guess, advanced technology. So there you go. So we've got some. It's very important with extensive amount of swelling in your lower leg. If you do start to have some break-in or some opening in the skin that are called wounds, and it's leaking fluid, we have to have two things to help manage that. We have to have consistent compression, you saw with the Velcro wrap product, and hopefully an advanced dressing to help not only soak up the excess fluid, but maybe even contain it in the dressing to create that healthy healing environment to heal that wound. So, all right, so that sounds good. So there's your lesson today on advanced wound care products in the lymphedema clinic, and I encourage you to get some additional information on the Eclipse super absorbent polymer, and can be beneficial for maybe you or some of your patients in the future. So thank you very much. Have a great day.
Thank you so much, Christopher and Bryan, for that video. You know, I'm in the NLN office, right, or I'm at the NLN office right now, and this is definitely not an endorsement, but you know, my daughter is right next to me. She was just watching that video, and she goes, "Wow, that looks like magic." And I have a patient who I'm seeing virtually who has a very wet wound, and so she said that would be perfect for your patient's slimy wound. Anyhow, but definitely not an endorsement, just, you know, a cute story to make it interesting. Okay, so let's see. I think we have one question for you here, Bryan. This is from Marianne. And the question is, would Neosporin, let me spotlight you, hold on one second. Would Neosporin be like a Vaseline or more like a lotion?
Definitely more like a Vaseline. It's definitely got petroleum in it. But it's also not as thick as like a Vaseline, so it really shouldn't be used as a barrier either. So it kind of, yeah, it won't work as a barrier, but it's definitely not a lotion.
Yeah, definitely not a lotion. And there are also some versions of Neosporin that are not even petroleum based. It's like a cream, thin cream based. And so either way, it's an antibiotic, right? And I think that one of the main things that patients with lymphedema have to really be mindful of is to not overuse antibiotics, whether it's topical or whether you take it as medicine, ingest it. And, and the main reason why you want to be careful with that is because there is such a thing as developing a resistance to antibiotics, so that when you really, really need it, it's not as effective. And so, definitely consult your medical team, and this is definitely the area of the medical team to advise you on this. Even technically speaking, even though Bryan and I are lymphedema specialists, we really technically can't even advise you on the use of antibiotics. We would need like a prescription, even to use like Neosporin on wounds, right, Bryan? Or yeah, okay. So
for everything.
Yeah, exactly. So definitely something to keep in mind and just be mindful of. And whenever you're not sure about it, speak openly and communicate with your medical team frequently. But that is the only question we had in the wings for you. Let's see. Logistical question here in the chat. Will these videos be available for viewing after March? And the answer is yes. I'll tell you that we've been definitely going back and forth in terms of deciding, whether or not to leave these videos up indefinitely, open to the community, or to make them available for a short time after March, like maybe for a month, and then closing them out so that they are available only to NLN members. And we're leaning towards making it available to the community because that is how we can basically widen our impact. And I think that in order for us to be able to do that, we're just going to ask you that if you enjoyed the webinars, that you consider supporting us in some way, buying a hat, becoming a member, in any way, shape, or form. We'll take that. So I think that with that, we would like to now ask Erin Sokolsky, who is our marketing manager, to share your screen and your video, and you take over to announce our winner for the evening. And what we're giving away is a Circade garment. And Medi USA is one of our Magenta sponsors, and they are so generous that they basically are a big sponsor of our garment program, and they help us give away so many complimentary garments to patients who demonstrate financial need. This is continuing with their effort, continuing with their generosity. And so tonight's winner is drum roll. It's Vanessa. Yeah, Vanessa, I think, this is your second prize, and, we're not limiting it necessarily to, just one prize per person because, not everybody's interested in everything. And sometimes, if people are patients on these webinars, you might actually have multiple regions affected with lymphedema. So, if you're selected more than once, we're totally okay with that. All right, well, congratulations, Vanessa. Please do contact our project manager, Christy Blair. She's putting her email into the chat right now. And to everybody who has joined us today, thank you so much for your time and attention. We are so grateful for your engagement. We hope that you found tonight's webinar valuable and that you were able to take something away from it. And I think that if anything, the most important thing to take away is take good care of your body, take good care of your skin. The skin is like the most, I would argue, probably the most important like defensive organism, right? Organ, excuse me. And if it's not intact, it cannot, it's the first thing that will defend your entire body, like your vital organs and your skin, like everything else, your dermis and your muscles from infection. So it's such an important organ that sometimes is totally overlooked and underappreciated. And just give it a lot of love, take good care of it. If you get like even a small little scratch or a small little paper cut, even under normal circumstances, like even outside of the setting of having a lymphedema risk or having lymphedema, it's really important to take care of your skin and give it a good cleansing, giving it like a first aid ointment and covering it with a Band-Aid or some other covering to, protect it. So again, thank you so much for everyone who's joining. Thank you to my team. Thank you to Bryan for an amazing talk. And thank you to Medi USA, an amazing support of the National Lymphedema Network. Good night, and we'll see you tomorrow.